Parenting adolescents across the gender spectrum. The experience of parents whose adolescents identify as gender variant or transgender. This presentation is based on the research findings for my dissertation in the master's course in family therapy and systemic practice that I read in the University of Malta. The contents of this presentation will include an introduction to the rationale for this research project, as well as the literature that is available on the topic. I will also go through the methodology of how this research was carried out, and I will also present the findings through a table of superordered themes, as well as the salient findings. While I was doing some of the research, I came across this quote from an interview that Cher, the international singer, gave during an interview with Pink News in 2018 about her trans son, Shaz Bono. She said, "When I found out Shaz was transitioning, we talked about it a lot actually. But then Shaz didn't mention it anymore, so I kind of forgot. And what I think is there's such a fear of losing the child you love and what will replace that child. I think it's about the fear mostly. I felt, who will this new person be? Because I know who the person is now, but who will the new person be? And how will it work? And will I have lost somebody?" I chose this particular quote because I think it sums up some of the experiences of the parents that I interviewed. Starting off with the rationale behind the study. Basically, the study aims to better understand how parents of transgender and gender variant youth experience and understand their child's identity, as research focusing on the parental experience is limited. This study aspires to continue to address this gap and shed light amongst professionals working with trans and gender variant adolescents and their parents, and to support them in gaining more insight and be better equipped to work with such families. It also seeks to document and extend the parents' voice in making their experience known and better understood from a systemic understanding. This study aspires to understand the strengths and the needs of the parents, as well as the social structures that influence how they cope with this reality. Moving on to the literature available on families, gender identity, and family therapy. Parents, in fact, often feel completely unprepared to offer the support and guidance these children need, as quoted by Krieger in 2017. And while some parents may try to be sensitive and understanding, others may convey messages of rejection. Krieger also describes systemic family therapy as a space for changing rejecting behaviors of all parents and family members, and support them in understanding and making meaning of the adolescent's gender variance. Some literature on the parents' experience of the adolescent's disclosure and transition. I think a salient theme that is often associated with parents' experience of their child's trans or gender variant identity is that of loss, which is often associated with Kubler-Ross's 4 stages of experiencing grief. Wren in 2002 research suggested that a number of the parents she interviewed had been prepared for their adolescent's disclosure and gender transition. In terms of the parental experience of loss and coping, the literature says the loss experienced by parents may be associated with the gendered interaction with their child, as presented by Riggs, who explained that when someone is presumed to be one gender but then discloses that they are a different gender, the logic of replacement produces a narrative of loss. The author links this experience with cisgenderism, which suggests that one's assigned sex at birth through genital identification determines one's gender, and that gender defines the child in their totality. Going into the research question for this research, this study was designed to explore the understanding and meaning-making process of the parents whose adolescents identify as gender variant or transgender. The three main questions that I sought to answer was: what social constructs shape the parents' meaning-making process? What does it mean to the parents that their adolescents identify as gender variant or trans? What are the parents' understanding of gender variance in adolescents? And what effects or impact did this experience have on the relationships between the parents and the adolescent, and the parents' perception of this impact on the family system as a whole? Presenting the research design, I chose IPA, Interpretive Phenomenological Analysis, as I identified it as the methodology that best fit this research, since it privileged the participants' lived experiences and the meanings they assigned to them through their own interpretation. The data was collected through in-depth, semi-structured one-to-one interviews, as recommended by Smith et al., since it invited participants to share their experience in detail. Interviews were carried out online over Skype, since participants were from the UK and I am based in Malta. The reason behind this choice of interviewing participants living in the UK is because of my professional position within the services that provide support to trans adolescents and gender variant adolescents and their families. And to eliminate any bias in the research, I chose to carry out this research in another country. Each interview was transcribed, and through the analysis of each transcript, the main themes were extracted, as well as the overarching themes across the 6 interviews. The research was carried out with UK-based participants due to potential conflict through my work within the community. They were recruited to the Pink Therapy Network, which is run by Dominic Davis in the UK. The eligibility criteria was basically parents of gender diverse or trans adolescents aged between 14 and 19 years, and that the participants were in contact with a psychosocial professional or a support group. I interviewed 6 parents. We had Catherine, who is a cisgender female, and they were a parent to a non-binary adolescent. There was Albert, who's a transgender male, and he's a parent to a non-binary adolescent. We had Elaine, who's cisgender, and she's a mother to a trans male adolescent. There was Jess, a cisgender female, who's parent to a non-binary adolescent. Cara, who is non-binary herself, and she is a parent of a demigirl. And Benjamin, who is a cisgender male who is a parent of a non-binary adolescent as well, which is Benjamin and Catherine are the parents of the same adolescent. The superordinate themes that came out from this piece of research were the following. Anticipating the gender diversity, most parents expressed their anticipation of what they perceived to be apparent in their child's diverse gender identity and how they confirmed this. One parent explained that her outlook was always gender affirmative, yet she approached her son out of concern. Another superordinate theme from the research carried out with these parents was that of ongoing struggles. Ongoing challenges experienced by parents were varied, depending mostly on their social context, but also on how long they had known and with whom else their child disclosed their gender identity. There was also the superordinate theme of reactions and aftermath. The parents' reaction to their children's disclosure and how they felt is presented through this superordinate theme. And it reflected through their initial responses, experiences of loss following the news, and the parents' learning curve regarding gender variance. There was also another theme of supportive elements in the lives of these parents. The supportive elements identified by the parents were experienced as a ray of hope that encouraged them in their journey into parenting gender variant adolescents across the gender spectrum. Most of the supportive elements are located outside of the parent's self and within their network of family and friends, social networks, professional lives, and reflective spaces. The last two superordinate themes presented here are parents' love and respect for the adolescent and the meaning making of their experience. In the parents' love and respect for the adolescents, the love between a parent and their child is a unique kind of love, and Benjamin declared several times along the interview that he loved his child unconditionally, including Blake. He loved his children unconditionally, including Blake. Some participants showed their love and respect through sharing their concerns for their adolescents' well-being and responding to them by affirming their gender diversity. The making meaning of the parents' experience and understanding what their adolescent presented, each parent searched for and made meaning of this journey. For some, it was harder than expected, while others engaged in a process of understanding their child's journey and how this interacted with their own and the systems they formed part of. This slide presents the salient findings of this research. I found that parents who are engaging more in trans-affirmative narratives, these are the salient findings of this research. I found that parents who are engaging more in trans-affirmative narratives, so these are the salient findings of this research. Parents are engaged. These are the salient findings of this research. Parents are engaging more in trans-affirmative narratives and less with the narratives of loss and grief. Perhaps this is in contrast to previous research in the area. Highlighted the complex interconnections between the parental individual experience with the social climate and the global movements around affirmation and or rejection and vice versa. This in particular was about the interactions between the climates that are present within our countries and perhaps even our continents and the world, and how these were being experienced by also the parents, but also how these parents were also influencing and leaving an impact on the global movements especially those obviously on a more local level. In fact, this concept of bidirectionality explains this concept from a systemic perspective, which suggests that a gender variant persons, their parents and allies, also have a voice towards sustaining the affirmative stance towards gender diversity. Parents encounter challenges and need to receive both informal and formal support from their peers and support services. Parents who are more open to diversity and are critical of the dominant cis-normative discourse and gender norms would fare better in their journey with their gender variant adolescent. And gender variant adolescents whose parents are trans-affirmative have better outcomes in mental health and well-being. I'd like to dedicate this research to all the rainbow families that I have met in my professional capacity, and I thank you for your attention.